Most people believe that if a surgeon looks you in the eye and recommends an operation, it must be the right choice. The doctor has the white coat, the paperwork is ready, and you're told, just sign here and we'll fix the problem. I used to believe that too, until I started counting the patients who went in for routine procedures and came out permanently changed. Not better, changed. I remember Arthur, a sharp 70-year-old engineer. He walked in with nagging back pain and left 6 weeks later unable to walk at all. I saw a woman survive open heart surgery only to lose 6 months of her memory to complications nobody warned her about. Here's the truth. The older your body is, the harder it fights just to survive the operation itself. Not the disease, the operation. I'm Dr. Jonathan Caldwell. After 2 decades in the operating room, I'm here to tell you the uncomfortable truth about 5 surgeries that carry hidden, often lethal risks for people over 60. Think of it like a car with 200,000 miles. If you put it through the same high-stress test as a brand new car, do you expect the same result? Of course not. Yet medicine often treats a 75-year-old body with the same protocols as a 40-year-old. That is a dangerous mistake. Before we reveal the first surgery on my never agree list, I have a question. Have you ever felt pressured by a doctor to make a quick decision? Write yes or no in the comments. And if you believe patients deserve the full truth, hit that like button now. In an older body, anesthesia is an assault. The brain can enter a state of confusion called post-operative cognitive dysfunction that lasts for months. We aren't just talking about age. We are talking about frailty, the point where your body's reserves drop below a critical level. The real question isn't, can you survive the surgery? It's, can you survive the recovery? Stay with me, because I'm going to give you the 4 questions that will act as your shield. But first, let's talk about the most common major surgery for seniors and why it might be a battle your heart isn't ready for. Surgery number 1 on my never agree list without a second opinion is open heart surgery in frail patients. We call it CABG. The idea is simple. Your arteries are blocked, so we reroute the blood flow. For the right patient, it's a miracle. But here is what the brochures don't show. Open heart surgery requires stopping your heart completely. We put you on a bypass machine that does the work of your heart and lungs. For a healthy 60-year-old, that's manageable. But for a 78-year-old with mild kidney disease, that machine is a massive assault on every organ at once. Studies show a 30 to 40% risk of major complications, strokes, kidney failure, and prolonged confusion. In fact, 15% of high-risk seniors don't survive the first month. Today, there are often better ways like TAVI that don't require opening the chest. If your surgeon hasn't mentioned a less invasive approach, you need to ask why. Has anyone ever mentioned a bypass to you or a loved one? Did they give you more than one option? Share your experience in the comments. Your story might save someone else today. Surgery number 2 is aggressive spinal surgery. Back pain after 70 is almost universal. The solution offered more and more often is spinal fusion, locking your vertebrae together with metal hardware. Now, listen clearly. Some spinal surgeries are absolutely necessary to prevent paralysis. But elective fusion for chronic pain? The evidence is troubling. A study in the journal Spine found that in patients over 65, complex fusion had a complication rate exceeding 40%. The most common issue is adjacent segment disease, where the vertebrae above and below the fusion break down because they have to absorb all the mechanical stress. Worst of all, studies show that for many seniors, this surgery provides no better long-term pain relief than physical therapy and injections. No better, but with a massive risk of never walking comfortably again. If you're starting to realize that routine doesn't mean safe, please hit that like button. Subscribing ensures you're always the first to get these survival manuals for your health. Now, let's move to the hardest topic, major cancer resections. Surgery number 3 is the hardest to discuss because when you hear cancer, the instinct is cut it out, get rid of it. I understand that completely, but 2 decades in the operating room taught me one thing. The goal isn't just to remove a tumor, it's to give you more good years of life. Sometimes in a frail elderly patient, major surgery does the exact opposite. Take the Whipple procedure for pancreatic cancer. It is incredibly complex, removing parts of the pancreas, intestine, and gallbladder. In an 80-year-old with heart disease, the surgery may succeed, the tumor is gone, but the patient passes away weeks later from complications. We call this futile surgery. A study from the American College of Surgeons found that 1 in 5 elderly cancer patients experienced failure to rescue. Their bodies simply couldn't survive the recovery. You must ask, if we don't operate, what does watchful waiting or targeted therapy look like for someone my age? Often that is the path to a better quality of life. If you are navigating a tough medical decision, you are not alone. Subscribe and join our community. We're building a place to ask the hard questions. Drop a comment. Did your doctor ever explain the quality of life trade-off? Surgery number 4 is elective joint replacement in severely ill patients. Hip and knee replacements are miracles for the right person, but elective means you have time to prepare. In patients over 75 with heart disease or diabetes, the risks skyrocket. We're talking about deep vein thrombosis, clots in the legs that travel to the lungs, and hospital-acquired pneumonia from lying still too long. I'm not saying don't get a new hip. I'm saying don't do it until your body is optimized. Many hospitals use prehabilitation to prepare your heart and blood pressure first. If your surgeon is rushing you to the operating room without a plan to strengthen your heart, that is a massive red flag. Now let's talk about what actually happens to your brain under anesthesia. Now I want to talk about something surgeons usually only discuss in hushed tones. Post-operative cognitive dysfunction, or POCD. When you go under general anesthesia after 60, your brain isn't just sleeping, it's enduring a powerful pharmacological assault. In a younger brain, the fog clears in hours. But in an older brain, that chemistry can linger for weeks or even months. I've seen sharp, brilliant patients wake up and not recognize their own children. Doctors often dismiss this as temporary confusion, but for many seniors, they never fully return to who they were. This brain fog is actually neuroinflammation. It's your brain's way of saying it can't clear the toxins fast enough. And it's not just the brain. Your lungs and kidneys are on a ticking clock. After surgery, you're told to lie still. But for a senior, lying still is dangerous. It's the perfect environment for hospital-acquired pneumonia, an infection that kills thousands every year because weakened lungs simply stop fighting. If you've ever noticed a loved one acting different or confused after a surgery, please share that story in the comments. We need to break the silence so other families know what to watch for. If you're finding this vital for your family's safety, hit that like button and make sure you're subscribed. Finally, consider your kidneys. Anesthesia and heavy pain meds can put them into acute shock. If they slow down, toxins build up, creating a feedback loop that can trigger a heart attack or stroke. This is why the first 48 hours are the red zone. It's rarely the incision that fails, it's the internal systems that simply run out of fuel. The most important part of surgery isn't the hour on the table, it's the 100 hours that follow. Stay with me because next, I'm giving you the exact shield. The 4 questions that will change how you talk to any surgeon. Now, we've covered the risks, but I don't want you to feel powerless. Information without action is just anxiety, and my goal today is to give you a shield. Before any major surgery, there are 4 specific questions every patient over 60 must ask. Grab a pen and write these down. Question 1. What happens if I don't have this surgery? A good surgeon will give you an honest answer. If they say nothing urgent will change in the next 6 to 12 months, you've won the most valuable thing in medicine: time. Time to think, time to get a second opinion, and time to optimize your health. Question 2. Is there a less invasive alternative? Medicine has changed enormously. Robotic surgery, endoscopic procedures, and catheter-based interventions like TAVE are now available in most major hospitals. These are far kinder to an older body. If your surgeon isn't discussing them, you need to know why. If you're finding these questions helpful, please subscribe. My mission is to empower you to be an active participant in your own care, not just a passive recipient. If you've ever had a second opinion that changed everything, tell us in the comments. You might inspire someone else to advocate for themselves. Question 3. What does recovery realistically look like for my specific health profile? Not the average patient, you. With your heart history, your medications, and your unique living situation, will you be back on your feet in 2 weeks, or will you need months of rehab? The answer should be specific, not generic. Finally, question 4. What is your personal complication rate for this procedure in patients over 70? Surgeons track their own data. A confident, honest surgeon will be transparent. If they seem uncomfortable or defensive, that itself is vital information worth having. If you believe every patient has the right to know these numbers before signing a consent form, please hit that like button. Let's make transparency the new standard in healthcare. Stay with me for the final block, where I'll show you why your choice is more powerful than any scalpel. I want to leave you with something genuinely hopeful. This video isn't about fear, it's about options, because those options have never been more powerful than they are right now. While surgery can be a miracle, optimized medical management is often just as effective for many conditions after 60. I want to tell you about Gerald. Gerald was 71, a sharp retired engineer. 3 different surgeons had recommended open heart surgery for a blocked artery. Gerald wasn't afraid of the pain. He was afraid of losing his independence. He had watched his wife go through a major operation 2 years earlier, and he told me, "Dr. Caldwell, she went in as my wife and came out as someone I had to take care of for the rest of her life." When I reviewed Gerald's profile, his kidney function, and his frailty score, I sat with him for 40 minutes, not 15. We discussed an aggressive medication protocol combined with cardiac rehabilitation. We chose the non-surgical path. That was 4 years ago. Last month, Gerald sent me a photo from the top of a hiking trail in Colorado, standing with his granddaughters. He didn't need a knife. He needed a plan that respected his body's limits. This is the most important thing I will say today. A surgical recommendation is not a verdict. It is the beginning of a conversation. You are not a passive recipient of medical decisions. You are the CEO of your own health. The surgeon holds the scalpel, but you hold the choice. If this video helped you or someone you love think more clearly about a medical decision, please share it right now. That one share could be the reason someone avoids an unnecessary tragedy today. And if you haven't already, subscribe and hit the notification bell. We have much more to discuss about protecting your heart and your future. Before you go, I want to hear from you one last time. What is the one question you are going to ask your doctor at your next appointment? Write it in the comments below. I read every single one of them. Take care of yourselves, stay curious, stay informed, and remember, your heart has been beating for you every second of your life. The least you can do is pay attention to what it's trying to tell you. I'm Dr. Jonathan Caldwell, and I'll see you in the next video.